All PicoSure systems ship with the focus lens array capability, and 3 focus treatment tips are included. Focus is usually used with a 6mm handpiece, but the 8 and 10 are also available. The focus lens array is composed of a closely packed hexagonal array of diffractive lenses to focus and redistribute each pulse. It serves to concentrate energy into hundreds of microspots. Fluence within each microspot is magnified up to 20 times that of a standard pulse, and it's delivered in a fractional manner. 70% of total energy is delivered through the microspots, and the remaining 30% results in low fluence background. By design, less than 10% of the tissue is exposed to ultra-high fluence. This injury generates new collagen and elastin with minimal downtime and discomfort. In contrast, thermal-based lasers create a column of injury in the skin, resulting in more downtime and pain. PicoSure Focus creates an incredible phenomena under the skin, which I will now describe. This graphic will help me explain how PicoSure Focus uniquely creates an area of laser-induced optical breakdown in the skin, commonly referred to as an LIOB. A high-intensity portion of the PicoSure 755 laser beam created by the focus lens array irradiates a region in the epidermis. A lucky electron from melanin is ejected from an absorber. The number of free electrons grow in an avalanche process. The target increasingly absorbs energy from the beam and shields the underlying region. Finally, the laser pulse terminates, leaving a vacuole in the epidermis containing cellular debris, but is not connected to the overlying skin structure above it or below it. The question is, what is happening in the skin? We have views here at 10 minutes and 24 hours after treatment. This question has intrigued me and has inspired much of my histological clinical research. Immediately after, approximately 10 minutes after focus treatments, the first 2 images demonstrate the vacuoles, voids, which we refer to as LIOBs in the epidermis. 24 hours after focus treatments, the melanin staining in the second 2 images show clumped melanin in these injury zones. No thermal injury is noted to the dermis or in fact the surrounding epidermal cells. The third set of images at 24 hours after a focus treatments show dermal inflammation and a healing response, which we believe leads to new collagen, mucin, and elastic tissue. This very nice series of photos demonstrates a typical patient with a PicoSure Focus treatment. We can see here immediately after, and up to 3 hours, you see some residual erythema. This can be easily hidden with makeup. At 24 hours, no residual erythema remains. PicoSure Focus users, as well as those considering adding focus treatments to their practice, are often asked to compare the complete patient treatment experiences and results among different non-ablative and ablative laser treatments. This can inform how to position the focus treatments for your patients, knowing many will generally prefer revitalized skin results with minimal downtime and discomfort. I would like to compare PicoSure Focus histologically to other fractional treatments to distinguish them based upon the type of injury they create and the downtime associated with the patient's treatment experience. With most non-ablative treatments, you can see columns of thermal injury that with more aggressive settings, you can see them penetrate deeper into the dermis. Both of these leave an epidermal injury that's open to the air. With focus, there are no open lesions and no thermal injury, just an LIOB with the benefits that appear to lead to collagen and elastic production as well as mucin. It is interesting to think that we can have an isolated epidermal injury lead to dermal repair and remodeling. The question is, what happens to the skin after a PicoSure Focus treatment? If we look here at these 3 slides, we can see the initial injury, the LIOB, and then over a period of days to 2 weeks, we can see that this forms a menzone that migrates up the epidermis and is exfoliated at the end of 2 to 3 weeks. This slide graphically shows the high-intensity region fluences with the different handpieces. The 6mm, my typical handpiece that I use for most patients, shows a very high energy focus at the surface. As we go to the 8, We cut this to 56% of the original handpiece energy and to the 10 to 36%. Typically, for my darker skin types, I'm using the 8, and then we'll later go down to the 6. But again, you have choices with different energy configurations to best suit your patients. While I have studied and continue to study the focus histology closely, Dr. David McDaniel has also used PicoSure Focus frequently in both clinical studies as well as his practice. This histological slide shows collagen on one of his patients 6 months after 4 focus treatments. Note the increased collagen deposition, the blue stain. This correlates with fine line and wrinkle reduction. Also very interesting is the increased elastin density 6 months after 4 focus treatments. Note the increased density of elastin fibers, the gray stain. This is what leads to the visible improvements seen in our patients. In clinical practice, patients are often seeing visible improvements after their first PicoSure Focus treatments, but they also see continued skin revitalization even many months after their 3rd and 4th treatment. This is likely a result of new collagen and elastic tissue deposited over many months. These exciting results have also been reported by another group, Dr. Roy Geronimus and his colleagues at NYU. They documented increased collagen, mucin, and elastic tissue 3 months after a series of PicoSure Focus treatments. Summing up, PicoSure Focus has unique advantages. Before I share some representative before and after photos from my practice, as well as other PicoSure users, I want to summarize some of the unique advantages of PicoSure Focus. An LIOB, a very elegant, unique injury in the epidermis that results in increased collagen and elastic tissue fibers. Visible clinical benefits without traditional downtime seen with most ablative and non-ablative procedures. Comfortable, easy and quick treatments, high patient satisfaction. This is a practice differentiating procedure which can be performed all year round, summer as well as winter. This is a nice photo from Dr. David McDaniel showing photo damage treatment. We see improvement of fine wrinkles, coarse wrinkles, and mottle hyperpigmentation. Next are some photos by Dr. Weiss. This shows before and afters, fine wrinkle treatment associated with photo damage. We can see here, after 4 focus treatments, improvement in these, especially on the lateral canthal area. The next set of photos is a patient of mine who is a skin type 4, MI of 27, who had a series of 4 focus treatments. You can see improvement of the acne scars, dyspigmentation, as well as the overall lightening of her skin. The next group of photos are a patient of mine who has photo damage with mottle hyperpigmentation after a series of PicoSure Focus treatments. You can see an overall lightening of the skin and an improvement in the skin tone. The next set of photos is from Dr. Shin in Korea. These show patients with dyspigmentation, lentiginous, and mottle hyperpigmentation. We see improvement after a series of PicoSure Focus treatments. The next set of photos are from Dr. Roy Geronimus' group in New York. They show improvement of a patient with acne scars and also dyspigmentation after a series of 4 PicoSure Focus treatments. We can see nice improvement of the quality and tone of the skin. This is a set of before and after focus treatments from Dr. Roy Geronimus. This is for acne scars. We can see improvement of the depressed areas on her cheeks, as well as the overall tone of her skin. These photos are from Dr. Saluja, a patient with acne scar and dyspigmentation after a series of focus treatments. We can see very nice improvement of the changes associated with this scarring condition of his face. This is a patient from Dr. Saluja's practice with dyspigmentation and photo damage that shows improvement over a series of 5 focus treatments. We can see the pigmentation as well as the fine wrinkling improve. The next photos from Dr. Saluja show a patient with lentiginous and mottle hyperpigmentation with improvement after 1 focus treatment session.